Hello, I'm Shannon, and I am someone that suffers from sickle cell disease. And I am currently in a bit of a crisis, and I'm struggling a bit. I was diagnosed with sickle cell at the age of 2 when we were stationed in Japan. It has been a very long, different journey. I feel that I am a miracle, and I've also been told that because for the first 30 years of my life, I lived without any type of medication, and that's the way I wanted to always live because I'm very anti-drug. I never did drugs or anything, and I never wanted to do them. I have this weird thing that when I die, I want my autopsy to say negative to everything. I don't know why. I don't know, that's just me. Basically, the big thing about when you have a disease like this, you have to have a great doctor. And my dilemma, during COVID, I lost my doctor that I had like almost 20 years. He moved, so he doesn't practice here anymore. So I had to find another doctor, and that was very hard in itself because not many doctors will take on sickle cell patients. They mainly focus on the cancer patients. And being that I see oncologists, hematologists, we take, the same medicine that cancer patients take. So most of them will just focus on the cancer. They don't want to deal with us. So it's hard to get a new doctor. The doctor that I had, he had us very, very spoiled. He was wonderful, and he just wasn't just a doctor. Like, his bedside manner was fabulous, and he had studied sickle cell when he was going to medical school. So he had been over in other countries in Africa doing volunteer work, helping out. So he understood the disease, which is what I appreciated about him. He really actually cared. So he knew his patients. He knew me. So if I walked into the office, he could look at my eyes and tell me, okay, yeah, you might need some blood, or you're not having a good day, or you need to do this. And if he felt like I needed to go to the hospital, he would do a direct admit. Call ahead, let the hospital know I'm coming, have my bed ready, so I don't have to sit in ER for hours. And my problem is I don't like to go to the hospital. One of my years, I spent 10 months out of 12 in the hospital. Birthday, Christmas, all of that. So I genuinely don't like to go to the ER, and especially when I had children. I knew that I would have to worry about, I got to find somewhere for them to go while I'm in the hospital. I've been in the hospital a couple, maybe a week to as much as over a month. So it's kind of hard to get people that will watch your kids while you're in the hospital for a month. So I always was like, no, I'm not going to ER. So when you're in the area with the doctor, I was living in the area that he practiced. So I went to the same hospital. If I got sick at home, my son would call 911 in a minute if I didn't want to go to the hospital. So the ambulance would take you to the hospital of your choice in the area. The problem I have now, the doctor that I have, he is way in another city that's like almost an hour away from me. So the ambulance will not take me there. He doesn't practice at the hospital where they know me, where they have my history. They know what regimen that my doctor always gave for me to, feel better and get out of a crisis pretty quickly. So it makes me especially not want to go to ER because I'm like, if I go to ER, my doctor isn't there. And all the doctors that are on call, they are afraid to give Dilaudid, morphine. They don't want to give narcotics to you if you're not their patient, because everybody's so concerned with addiction. Is she a junkie? Is she just here, trying to get pain relief? When all they have to do is look up my record, and they'll see how many times I've been there, how long I've stayed, what regimen works. But you know, they don't want to just be bothered with us, which that's kind of wrong, but okay, your choice. So I've been struggling for the last week in this crisis and needing to go to the hospital but not wanting to. But I've made up my mind that I'm going to go today. When my son gets off work, I'm going to have him to come take me. Because I'm at the point, I know my limits. I know how long I can just stay at home and be like, I'm going to stay, I'm going to deal with it, I don't want to go to the hospital. Then I know when I get certain symptoms that it's time to go. When my fingers and toes are numb, when I'm seeing stars, flashes, when my chest is hurting, when my home medication isn't working, when I start hallucinating, like I'm past the point of no return. Like that's time for me to go, because I know they usually give us fluids. They give you oxygen and pain medicine and all kind of stuff. And I just don't like to not be in control. That's been a big struggle for me when they give you pain medicine in the IV and it hits you so quick because it's going in the IV. I don't like that what drug addicts like. They like the high, the rush. That makes me so uncomfortable because I feel like I don't have control. And then you're there, you're in this haze and you can't control. Like I've been in the hospital before and I've gotten visitors. My aunt came to see me in the hospital on my birthday one year. I didn't even know she was there. Didn't know she had been there. And my daughter used to make this joke about when she comes to see me in the hospital, when I start dozing off or start talking, mumbling, she knows it's time to go because, she know the pain medicine didn't hit. I don't like for people to even visit me when I'm in the hospital because it's like, I don't want you to see me not in control. Like, I don't want you seeing me drooling, or head nodding. Like, that is not the look that I want anybody to see. I don't care if it is my kids or whoever. So I really, really, really miss my doctor. I wish I could find a great hematologist or oncologist that would be willing to take new patients because it's so hard to get treatment with a doctor that is so far away. Like, even if I go to ER, I would have to drive over an hour to go to the ER that he affiliated with. And like I'm at the point where I was barely able to get in here and sit in a chair. So it's like, I'm not gonna get in a car and ride for an hour in this kind of pain. So any hematologist out there that would be willing to take new patients, please post me something, let me know, send me your information. No disrespect to the doctor I have now that I had to get because I had to have somebody when my doctor left because I have a port that has to be flushed every month. I have to do my lab work. So I have to be able to get my medicine prescribed. So you have to have a doctor. So it's nothing against him. He's a nice guy. His they're nice people, but they are just so far away that it's just impossible for me to get the type of treatment that I need when I need it, like I'm accustomed to. Like this, if I would call my old doctor and he'd be like, okay, meet me at the hospital. I show up, they got a room, they just wheelchair me up to the room. It's just not like that anymore. So it's so hard. And that even really makes me not want to go to ER because you get there and you're finna have to sit 3, 4, 5 more hours. And then nobody really knows how to deal with a port. So you got to wait for them to find somebody that knows how to access a port because I don't do anything with my veins because they're dead. So everybody wants to get the veins. They don't want to deal with the port. So you have to wait for them to find somebody. And it's just such a hassle. So I just can't. I just can't do it right now. I have been blessed to have some really good years. Like I said, the first 30 years of my life, there was no medication. I just suffered in silence. I just dealt with it, over the counter stuff. And it might have been too because I was younger, because this disease does get more aggressive the older you get. And mine really, really got more aggressive after I had my son. I have two children. I was told I couldn't have any kids. I have two children. And when my son came along, he's 26, that's when mine got even more worse. Like, I started seeing all these hospital visits. And I don't know if it's because I had never been doing the hospital visit. I hadn't been getting the treatment that I should have been getting. I don't know. But I did have a doctor tell me that I was a miracle because I still had a lot of fetal hemoglobin that had been protecting me from crisis. So I was very grateful for that. So anybody out there that has this disease or any kind of pain disease, chronic pain disease, I'm sure you understand what it is and how important it is to have support. You have to have a good support system. I know I say to myself a lot, I don't discuss anything. I keep it to myself because what is the point? There's nothing that anybody can do. I'm not a complainer. Like, I don't want to complain because there are so many people that are worse off than me. And there are people that aren't even here. I lost my god sister to this same disease a couple years ago. So I would never complain about pain, because I'm still alive. And I was told, well, my parents were told I wouldn't live over 30, 40 if I was lucky. So if you know someone that has a disease like that, make sure you let them know that you're there. Check in on them because we are loners. We don't ask for help. And with me, I'm a stubborn Capricorn, so I feel like I can do everything by myself. So I would never call and be like, "Hey, I need help. I'm in pain." I would just sit here and be in pain by myself. That's just how I've always been. I just don't ask for help. So it's good if you have people in your life that know that you're like that and will call you. And my son, I'm glad I have him because he can tell when I'm at the point where I should have been at the hospital. And he's very aggressive about it, like he is now. This is why I'm going to ER today, because he's basically like, you don't have a choice. I'm taking you. So, okay, I surrender. But look out for each other. We don't know how long we're going to be here. Everybody's journey is different. But we do all have a lot of stuff in common. I did have a good run with this disease because, like I said, I lived a long time without a lot of major issues and all kind of hospitalizations because I refused to go to ER. But I was able to work. I was able to do stuff that they told me that I could not do. They told my parents I wouldn't be normal. I wouldn't have kids. I wouldn't, be able to be in sports like other people. And I spent all my life trying to prove them wrong by going to college, trying to get on the basketball team, getting in ROTC, getting in the choir, just doing stuff everybody else did because I didn't want to be that sick person that can't have a normal life. And I grew up not telling anybody. I kept this to myself. My best friend, my child's father, did not know anything about this. I kept this to myself. And maybe that's not good because of something. If I would have had a crisis around these people, they wouldn't have known what to do. I get it. But when you don't want to be looked at, like something is wrong with you because you already feel that way because you're different. You have this illness that nobody else has. And you go through stuff that they don't go through. So you're already different. You don't want to be looked at as the sick one, that needs handling. We got to handle. No, you don't have to handle me. I'm a normal person. Treat me as such. Y'all have a good holiday. Look out for each other. Be blessed. disease.